Welcome to Straight Talk with My OBMD podcast. Join me for a bi-weekly discussion on topics most relevant to women's health today. We are your source for medically accurate, real-world advice and all things related to your health and well-being as a woman. From menses to menopause, we've got you covered. I'm your host, Dr. Dana Smith, a fully practicing, board-certified OBGYN physician with close to 20 years experience. I am also the founder of the website that is 100% dedicated to women's health, myobmd.org. At myobmd.org, we write in all aspects related to women's health. Listen to our podcast, visit our website, subscribe to our newsletter, and follow us on Facebook and Instagram, myobmd.org. All right, so welcome to another episode of Straight Talk with My OBMD. I'm your host, Dr. Dana Smith, proud founder of myobmd.org, the website that is dedicated to your health, where we publish all women's health information, and everything you see and read and hear on our website are written and authored by physicians. So you can trust the knowledge of the material on myobmd.org. Today we have with us physician extraordinaire, Dr. Amanda Adkins. Dr. Adkins is an amazing physician who has written for myobmd.org, and I have asked her to be a guest on our podcast so she can share her knowledge. Dr. Adkins, in addition to this podcast, she has recorded another podcast talking about nutrition and mood, which you can find at the myobmd.org site. Today, we are going to be talking about stress and how that relates to high blood pressure. So stress and hypertension. But before we get into the meat of the topic, Dr. Adkins, welcome. And if you wouldn't mind introducing yourself to our audience.
Yes, I am Dr. Amanda Adkins, and I am a board-certified internal medicine and lifestyle medicine physician who focuses on helping women who have chronic illnesses prevent or reverse their illness with decreasing their medication as much as possible.
Awesome. And who does not want to decrease their medication and possibly even get off their medication? There are just so many reasons to do that, not just, hey, you don't have to worry about did I take it, but also financially.
Exactly.
Less money going out to a medication. So that is something that ourselves and our viewing audience, I'm sure, are focused on. And today we wanted to talk about something that is commonly touched on, stress. But we as physicians also recognize that stress is a loaded word, right? Stress can be so many things to different people. And also stress can be consequential. So first we wanted to, Dr. Adkins was gracious enough to agree to just discuss with us how stress relates to high blood pressure and how we can take measures to handle stress that can reduce our high blood pressure. So Dr. Adkins, I want to start with first reading a definition of stress that the WHO has put out. And WHO is the World Health Organization. So the stress as defined by the World Health Organization is a state of worry or mental tension caused by a difficult situation, right? You agree? Okay, and then there are different types of stress, right? So a good stress is a stress that alerts us to danger. So if you're gonna crash your car and your armpits are sweaty and oh my God, you slam on the brakes, that's a good stress because that stress just saved you from injury, potentially life-threatening injury. So stress is not necessarily a bad thing. Right?
Right.
So tell us about stress and its relation and if you wouldn't mind, I'm a OBGYN, you're the internal medicine doctor. Tell us first about hypertension, how would we do define the hypertension, and how we discover this relationship between stress and high blood pressure.
Okay, so high blood pressure is usually, well, it's changed. The actual definition changed for years of when you actually diagnose someone with hypertension. But high blood pressure in itself is, our arteries don't they're hardened over time with different issues, whatever it's going on, and it doesn't go down as well. I'm not explaining that as well as I'm trying to think in my mind. It's not coming out. But if you actually look at the numbers, so we have a systolic number, which is the top number, diastolic number is the bottom number. We want that top number to be 120 or less. I shouldn't say just less. So between 100 and 120. And then the bottom number, we want that less than 80. Before that was higher, people would say you wouldn't have high blood pressure till it was the 140s. But now we're looking at the systolic number being in the 130s, actually the stage one of hypertension, and you actually can be diagnosed with hypertension at that time, or if the bottom number is greater than 80. So I want to say that because sometimes people are like, oh, you guys just changed it because you just want us to come back more and give us medication and get more money. But actually, they show that your complications from high blood pressure increases once your blood pressure stays above 130 or if it stays above 80 at the bottom.
Mm-hmm.
So
Mm-hmm.
that's why it changed. So I just want people to know. And of course, the higher the top number goes and the higher the bottom number goes, the higher risk for having a stroke or a heart attack or damage to your kidneys, damage to your eyes, that you can definitely be irreversible. So you want to be very cautious. We also call hypertension or high blood pressure the silent killer because a lot of people don't have symptoms of high blood pressure unless you actually go and have it checked, and then your doctor tells you, oh, did you know your blood pressure was high? And people will say, oh
Mm-hmm.
no, I didn't know that because I don't check it.
Mm-hmm.
So stress definitely can increase the blood pressure. I have a lot of people that come in and say they had a stressful day. Different hormones inside of our body can cause the dysregulation of the way our arteries contract and relax. So that can actually increase our blood pressure. And so when people come and tell me that, we always talk about ways to reduce their stress and what else they can do. So I think that's what we'll be discussing today.
All right. Well, all of that sounds really good. And I know that as far as the the blood pressures, we know that as our heart is pumping blood like 80 to 100 times, 50 to 100 times every minute. And the pressure that the heart requires to get that blood to the rest of our body. That's part of what that blood pressure measures. And we know that when we're anxious and our vessels are really tight, it just takes a lot more pressure for that blood for that heart to get that blood flowing through those vessels. And I guess I always like tell patients, like, think about like if it's a silk road versus a gravel road, so you want your blood to flow across a silk road, it'll be just nice and smooth flow. And if it's focusing in on a gravelly road, then of course you're gonna need more pressure to just push that blood along that road. So you want your blood vessels to just be nice and smooth. So so with that being said, we know that, like, for instance, patients in the hospital, they have physical stress because, especially in my department, right, in labor, lady having in labor, she's going to experience physical stress, and that physical stress in the form of pain
Mm-hmm.
will cause high blood pressure. So that's a physical stressor. Now, we also know that the mental or emotional stressors, social stressors, these are the stressors that we are discussing now. Like, how what are your thoughts on how that and how much of an effect, how does it affect our blood pressure, and how much of an effect, how much are we blaming our blood pressures on this? It may not be that or something else.
So I mean, if you think about if you're driving down the street and somebody cuts you off, or
Mhm.
you like that rush of adrenaline that you have, like you expect your blood pressure to go up. But what most of the time I see for my patients, especially in internal medicine, is that chronic low stress, like the stuff that you're dealing
Mm.
with every day, all day,
Mhm.
that is hard because it's external and internal. Like you have the stressors of work, whether it's a coworker that is not carrying their weight and therefore you're expected to
Mhm.
do so, or if you have a supervisor that's always on you, if you have a child that is special needs, that you're
Mhm.
always concerned with, or a child that has mental health issues, something like that, that you're always concerned about or worried about. If you
Mhm.
have financial issues, like I can't come to the doctor's appointment because I can't miss work, and you're here having me come in and saying my blood pressure's high and you want me to come back in 2 weeks. I have people that tell me that all the time. So those types of stressors that is not where you can just poof, they're gone away. It's not like, oh, I'll swerve that car, I'm done with that accident, I can
Mm.
release the stress right now. But it's those chronic low grade stressors that are getting people, and that's the stress that I tell people that is likely causing are
Mhm.
contributing to their high blood pressure
Mhm.
when they come into my office.
And I just want to take a moment to pause and just say that we get it. We get it why someone would have high blood pressure under those conditions. So no one is saying, hey, this is inappropriate, or we get it that these are real life stressors and these are really worrisome topics, and it is a real form of stress. So we also get it that this is something that is stressful. So we are in no way minimizing the stress of the situation that you may be going through. However, it is also true that we would like to make sure that to give you the tools to be as healthy as you can be um, as you are going through this process, because you may not be able to change that process or that environment right away. But let's see what we can do to help you to stay as healthy as you can as you navigate those waters. So how would you approach someone who is having some of these real life stressors, and it's very real? How do they, and they may already be on blood pressure medication.
Mm-hmm.
Um, how else can they attack that outside of the medication, in addition to the medication, rather,
Mm-hmm.
to help themselves stay healthy?
So I have them focus on themselves. Number one, is like you can't change what other people are going to do. You can't change how other people are may respond. So you want to actually look
Mm-hmm.
inside yourself and see what you can
Mm-hmm.
do. So I shouldn't say you, because I put myself in
Mm-hmm.
that. I have a stressful job with a child and all that kind of stuff. That we want to do something that will relieve that buildup of stress every single day.
Mm-hmm.
You don't want to wait till it's like over the top. Because like I said, it's usually just these constant small little insults that causes us to have then the high blood pressure.
Mm-hmm.
So one thing that you can do easily at work, which I actually work with a meditation teacher on different things to do during the actual time that you feel overwhelmed or try not to get overwhelmed. One is just taking a deep breath. Most of the time, we
Mm-hmm.
breathe very shallowly,
Mm-hmm.
and we're not actually
Mm-hmm.
getting all the air in, all the air out. I actually have a little index card on my computer at work that says, take a deep breath in for 4 seconds, hold it, and then blow it out for like 8 seconds. And then, take a
Mm-hmm.
deep breath in for 5 seconds, hold it, and then blow it out for 10 seconds. And then continue to go up until like eight. Again, a
Mm-hmm.
meditation person taught me that, or
Mm-hmm.
breathing techniques. And you would be surprised on how quickly your stress level comes down. And you can do that
Mm-hmm.
throughout the day, several times throughout the
Mm-hmm.
day, and that will actually help decrease it down. Another one that people laugh at, and it's because you laugh, it's very funny. It's actually just laughing. And you're like, there's
Mm.
nothing funny about my situation. And it's like, it doesn't, nothing has to be funny. If you just start laughing, and you would start laughing and start laughing for real, because something will come to mind, or you'll say, I sound
Mm.
so crazy, why am I even laughing? And you'll laugh harder. It is like, I want people to go down the, like, if you're on the street, just put in your headphones and people think you're, listening to something that's funny, and you just start like a little chuckle first, like ha 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 ha. Like, you'll start like that, and then before you know it, you're like all in, like leaning over, like, and just that, like, it just, like, decreases your synthetic nervous system. It really puts in the
Mm.
parasympathetic nervous system and just calms you down. And you can do this in the car, when traffic, walking down the street, in your, even if you're in the work at the cubicle, like, you may get looked
Mhm.
at crazy, but you may just go to the bathroom and do it and just like relieve yourself. It
Mm.
works. I'm just telling you, it works. I do that.
I believe it.
Yes, my sister laughs at me every time I tell her that I tell people how to do that, but it works. It's just funny,
Hmm.
to have that. So those are two big things,
Hmm.
um, that people can do in the moment, are just
Uh-huh.
right there. I also tell people to go for not necessarily a exercise walk, but just like a mental health walk,
Mm.
where you're just like looking at, the trees, looking at the sky, breathing in the air. I love like hiking. But I also
Mhm.
do this every day at lunch when I'm at work. It's just like to reset. We
Mhm.
don't want to grind through at work. Even though you're like, I got to get this done, I got to get this done, but you're going to be more productive if you have a clearer mindset. So if you go out and
Mhm.
just take a walk for like 15, 20, 30 minutes. So, eat your healthy lunch before you go
Mhm.
out, and then just go for a walk. And you come back and reset. And I have found that I can get work done and get out of work on time than if I try to stay through and grind through lunch
Mhm.
hour.
Mhm.
So I know a lot of people that's actually worked for.
Mhm.
Journaling is
Mhm.
also very good for people for decreasing stress, because it's another way to get the thoughts out of your mind that you keep
Mhm.
playing over and over and over. Get them out, get them on paper. Sometimes people just leave them there. I don't necessarily say reread them. You don't need to reread them to put them back in your mind, but just leave
Mhm.
them there. You can throw the paper away, and like,
Mhm.
you're just getting it out of your mind. You have to get it out of your mind, out of that cycle,
Mhm.
and then just and get it going out, and then you'll find that your actual stress decreases, because that worrying and anxiety does not build up in your
Mhm.
system. And you can do that multiple times a day too,
Mhm.
to get that out. So those are the things that I've done, that I've had people do, that actually has helped decrease their stress.
Mhm.
That's not necessarily like what I talk about also is like exercise and nutrition. But those
Mhm.
are a huge things that people can do, and they're like, it makes a difference. And it doesn't take extra work. You don't have to go through a class to do it, or to learn
Mhm.
how to do it. Of course, there's different meditation apps that people can do also if they want to do meditation, but I find that harder for people to have to set aside time. I do that in the morning, but
Mhm.
actually in the moment, I think these actual tips help people better.
Wow, I was taking notes. I was taking notes because I just found that to be so incredibly valuable. And it's so valuable. It's more valuable to me because of the simplicity of it all.
Mm-hmm.
And but it's super valuable. And in fact, I will write this down and make sure there is an article on our website with this information authored by Dr. Amanda Adkins. So I have just to refocus, focus on self. When you first said that, I thought, oh my gosh, you're going to focus on yourself when you have a special needs child. Okay. So focus on self. Um, two deep breaths, 4 second in, 8 second out, 5 second in. So breathing in and then breathing out slowly, twice as long as you breathe in.
Mm-hmm.
And then number three is laugh intentionally for no reason. I I do it every time I say it, I do it. And then four is to take a mental health walk and resist the urge to the pressure that we place on ourselves that we can't do it because we have to get things done. Because it reminds me of that Steve Covey principle. You have to stop and sharpen the saw.
Mm-hmm.
So you have to, that's your stopping and sharpening the saw right there. And then journaling. Now, journaling, I want to ask, sometimes do you write down the stuff that worries you, or you write down affirmations or positives? Doesn't matter.
So it depends on what is going on at the time. So there's times where I will just write out what I'm feeling,
Mm,
to get all that out so it doesn't build
mm-hmm,
up. If I'm trying to get ready for something, then I may write affirmations.
mm,
So it can
mm-hmm,
work either way.
mm-hmm,
And I initially started out with like journaling prompts, but then that got too stressful for me. So I stopped
mm,
doing that. So I was like, oh, let me see what I can find and talk about. But I'm like, no, the easier it is that somebody can do, and they can just like grab a piece of paper at work and do it.
mm-hmm,
You
mm-hmm,
can scrap piece of paper and you can write out just how you're feeling.
mm-hmm,
Somebody didn't do their
mm-hmm,
job, somebody didn't show up, something like
mm-hmm,
that. And you just write it
mm-hmm,
out and then just throw the paper away, because that's just
mm.
throwing away that thought, and like, okay, now I can be
Wow.
productive of how I'm going to go to the next level. What do I actually need to do, instead of focusing
Yeah.
on those thoughts.
It's like
Yeah.
a catharsis. You're purging yourself, you're
Yeah.
letting it out, and then you're discarding it. I absolutely love it.
Yeah.
I
I
love
just
it.
want to mention one thing, because you
Yeah.
brought that up. Like, when I said focus on self when you have a special needs person, and I tell people that's like caring for the caregiver. If you are not well, the person you're caring
Mm-hmm.
for is not going to be well. So that's why I
Mm-hmm.
started there. Just so you know, I'm
Mm-hmm.
not trying to be insensitive
No,
to
I get it.
the families, or
No.
anyone around, but that's
Uh-huh.
why I say that. And I tell my, especially women, that all the time,
Mm-hmm.
and just to let them know that it's okay, and it's okay to seek help, if you need
Mm-hmm.
more help, like with therapy or something like that, if you have extra stress,
Mm-hmm.
and that you're not less strong. I had actually a patient the other day that said, usually I'm stronger than this. I'm like, you are strong. You are strong. You're not
Mm-hmm.
usually, you are strong. So if we need assistance other places, then
Mm-hmm.
you're still a strong person.
Right, 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 right. Absolutely. And it's again, we talked about just in the last podcast about how industry shapes our expectations and what we focus on, what we define as normal. And so, I think over time and decades and perhaps generations, it's been, no, got to put yourself last. And thankfully, in the last few years, we have really done a lot to undo that that approach, because we know that that is not healthy. So yes, I get it, and I thank you for stating it, because it still doesn't come natural, I think.
Mm-hmm.
And so you always it's something you kind of have to remind yourself to. I have to focus on myself. What have I done for myself today or this week, or or this hour, whatever it is. So
Mm-hmm.
yes, focusing on yourself. And we I think that that is a lot to chew on, and that is such a treasure trove of ideas. I totally appreciate that. And then for the again, we are not saying that these are the only things for treatment of high blood pressure. We are saying that no matter what medication you're taking or how much you're taking, that these strategies and these steps will help you no matter what. So we want to have you include that, to have this be a part of your treatment of your high blood pressure. And to be quite honest, even for patients without high blood pressure, I think these are just generalized
Mm-hmm.
principles and habits that will help everyone.
Right.
Right?
To prevent it.
Exactly, exactly. Dr. Amanda Adkins, thank you so much for being a part of Straight Talk with my OBMD. Please let our guests know or where they would be able to find you and your services.
Yeah, so I have a website at www.dramandamd.com. So you can find me there, email, social media, any programs I may have coming up, YouTube channel link, all that is all there.
Awesome, awesome. And do you provide services remotely?
Yes.
Oh, even better, even better. So you can take clients from all over. Very good. And any other comments you want to provide before we bid our viewers goodbye for this episode?
I always just like to tell people before I leave them, because I'm a plant-based person, eat more vegetables. Even though we didn't talk about it on this, we always can add in more vegetables
All
somewhere.
right, all right. We will definitely keep that in mind. So, and I'll tell you a quick story before I go, right? Before we go, because I had some friends over the other day, and we were talking about how I made some soup because my pumpkin was about to spoil. So, um, and we were talking about how we're always like throwing stuff out, right? When you buy the vegetables, you're always like throwing stuff out, and how that actually discourages you sometimes from buying the food.
Mm-hmm.
But again, we actually just have to change our mindset, right? Because if you're throwing the vegetables out, if you have to, what I concluded, I said, I have to make peace with the fact that I'm going to throw some of these vegetables out every time I buy them. And because they are vegetables and I don't always eat as much as I intend to eat, and that's okay. And I decided I'm going to reward myself and say, you know what? At least you bought the right thing. You started off right. You bought the vegetables. You bought stuff that's spoiled. You didn't buy stuff that you can stick in your pantry and
Mm-hmm.
it's there for 2 years. So,
Right.
it's just again, just
The
that
small wins.
mindset of
Mm-hmm.
the little things that discourages us from being making the healthy choice sometimes. Because I mean, I've thrown out so much bananas, I've thrown out so much, but again,
Yes.
it's okay. I feel like if I'm not throwing it out, then I haven't bought enough.
Oh, look at that way. That's true. That's true.
As much as I try to eat as much as I can, but yes, sometimes you're gonna have to just throw it out, and we just have to make peace with that.
Yes. Yes.
So on that note, I want to say thank you, Dr. Adkins, for your for gracing us with your presence here today and for sharing your well-esteemed knowledge on how to practical ways on stress relief for the treatment of hypertension. And also our previous podcast, Dr. Atkins spoke on food and mood and the relationship between those two vital topics. And so this has been another episode of Straight Talk with my OBMD. I'm your host, Dr. Dana Smith. You can find this material and many other material on myobmd.org website. Thanks again for listening. Thank you for listening to another episode of Straight Talk with my OBMD podcast. To learn more about this topic, visit our website at myobmd.org. Subscribe to our newsletter, follow us on Facebook and Instagram. I can't wait to spend more time with you on our next episode of Straight Talk with my OBMD.